Hello, you have had an ICD or CRTD inserted so you can live as normal a life as possible. However, there are some changes that you need to be aware of. Driving. It is a legal requirement to inform the DVLA that you have had an ICD fitted. Whether you continue to drive depends on the reason you had the ICD inserted. If you are allowed to continue driving, there will be restrictions on when you can drive following a battery change, lead positioning, or firing of the device. Please refer to the DVLA for further information. Physical activity. For the first 6 weeks after your ICD is inserted, you shouldn't attempt strenuous activity or lift your arm above shoulder height. After this time, gradually start to build up your normal activities again. Moderate intensity activity is safe for most people with an ICD. Take care to avoid sports that could cause collisions and activities that could be dangerous if your ICD were to deliver a shock whilst doing them, such as swimming on your own. Sexual activity. You may resume sexual activity when you feel fit enough to do so. Try to avoid direct pressure on the wound for the first 2 weeks. Electrical equipment. Most home devices will not interfere with your ICD. Airport security measures rarely cause problems, but always make sure you carry your ICD identification card with you as proof. You can safely use your mobile phone, but keep it at least 6 inches from your ICD. Use the ear on the opposite side of your ICD and don't carry your phone in your shirt pocket. Medical equipment. Most medical investigations won't affect your ICD, but you should always inform all healthcare providers, doctors, nurses and dentists that you have a pacemaker. If you need an MRI scan, please discuss this with your cardiac physiologist to see if this is appropriate. You're likely to experience different symptoms depending on whether your ICD delivers an electric shock or a pacing impulse. If your ICD detects a fast, abnormal heartbeat, it may deliver multiple fast electrical impulses, which feel like a fluttering in your chest. These are called pacing impulses. If this treatment is unsuccessful, the device will then decide if a shock is appropriate. If your ICD detects a life-threatening arrhythmia that requires a shock, a few things may happen. Some people get a warning before a shock is delivered, such as feeling dizzy or feeling their heart race very fast. Others don't get any warning at all. Some people may collapse or become unconscious before treatment is even delivered. Other people remain conscious when a shock is delivered and will feel a heavy thump in their chest. This is not a pleasant feeling, but remember, it is life-saving. In the event of you collapsing and a shock being delivered, you should attend an emergency department immediately. If you do not collapse but receive a shock and feel well, contact your specialist nurse for assessment of the device. Your ICD is designed to deliver a shock if you have a life-threatening heart rhythm. However, there may be times when this is no longer appropriate. It may be turned off temporarily before some operations, or if you start experiencing lots of inappropriate shocks. Also, if your health deteriorates or you are nearing the end of your life, it may not be appropriate for your ICD to keep shocking your heart back to life. Deactivating your ICD will allow a peaceful death. A member of your medical team can easily do this with a magnet. However, it would only be done after a multiple disciplinary discussion, including your medical team and family. If you have any further questions or would like some more advice, please speak to your GP, cardiologist or specialist nurse.